a healthier life. This is Kara's Cures.
Welcome back, everyone, as we explore Kara's Cures here on the Kara's Cures Show. Thanks for being here. I'm Kara Sundlin. This is where we explore the cutting edge of wellness. And my question for you is, do you eat a brain-healthy diet? Well, today in Kara's Cures, we're talking about the link between what you eat and how we feel. Here with us now is board-certified psychiatrist and author, Dr. Georgia Ede. Thank you so much for being with us.
Thank you very much for having me, Kara.
So your new book, Change Your Diet, Change Your Mind, is out now, and it's chock full of a lot of information for regular folks and for doctors, a powerful tool to improve mood, overcome anxiety, and protect memory for a lifetime of optimal health. So you are a psychiatrist. You have spent the better part of your career learning how to use medicine for mental health, but you say psychiatry is changing.
There's really exciting change happening in the field of psychiatry, finally.
Okay.
So, after 75 years of thinking about mental health conditions as chemical imbalances in the brain that require medication, we now understand the real root causes of most mental health conditions, from autism to anxiety to Alzheimer's disease and everything in between: inflammation, oxidative stress, and insulin resistance, and these are rooted in our diet. So if you know which dietary changes to make, you can actually have tremendous control over your mental health.
So we're going to take a deep dive, because you say it's not as simple as just eat this, don't eat that. but let's start out with trying to make it simple. What's the problem with most diets right now that we're eating that you say are fueling our mental health problems? Because we have a crisis in the country right now.
We do have a crisis in the country. 1 in 4 adults in the United States has a mental health condition so serious that they can't function. And among young adults, ages 18 to 25, that's 1 in 3. So it's getting worse. And I think that our modern diet is largely to blame. Of course, not entirely, but there are signature ingredients in our ultra-processed modern diet which directly promote inflammation, oxidative stress, and insulin resistance. And those are the refined carbohydrates, sugar, flour, fruit juices, cereal products, those things, and vegetable oils like soybean oil and sunflower oil. Those are the signature ingredients of our ultra-processed, unhealthy diet. And if all people do is remove those from their diet as much as they possibly can, they will be going a long way towards reducing their risk for future mental health problems, as well as helping reduce the symptoms of existing mental health problems.
I mean, it's tough, because I have, I've got teenagers, and I do this work, so I certainly will say, like, hey, when you're struggling with anxiety or ADHD or anything, like, what we eat, it so matters, But I think it's really hard for teenagers, but also for adults. Like, we don't know. We're like, well, I'm eating basically healthy, so I had a little treat every now and then. But what you're saying is we don't understand nutrition as far as brain health.
Right, so the brain cares very much about what we eat, and the messages that we're used to hearing about eating for brain health are largely about, well, sprinkling superfoods on top of your diet, or maybe switching to a Mediterranean diet, which is better. It is better than, what most people are eating, but it really doesn't go far enough, because it still includes far too many of, for example, the refined carbohydrates like sugar and flour and breads and pastas and cereals and rices. And for most of us now, the majority of us now, more than 50% of us now, have this condition called insulin resistance, which makes it difficult for us to process large amounts of carbohydrate. So most of us can no longer safely tolerate the amount of carbohydrate that's recommended in a standard diet or even in the Mediterranean diet.
Yeah, so this is where we don't know. And I told you that I was doing a story about losing weight after 40, and our naturopathic doctor was talking about, we need to reduce the carbohydrates. And as you said, insulin resistance is a big problem, but most people aren't even being tested for that. I had what she would say, I was just over the line of showing some insulin resistance, but there were things I can do to correct it, like drastically reduce whatever carbohydrates I'm eating. What is insulin resistance? How do we even know if we have it? Why aren't doctors testing for this?
Yeah, that really needs to change because most of us do have insulin resistance and most doctors are not testing for it. So what they're testing for instead is they're testing for type 2 diabetes.
And then it's kind of too late?
And then it's not that it's too late, but you certainly want to know if it's coming 10, 20 years earlier.
Okay.
So insulin resistance is simply a condition that develops when your insulin levels in your blood are running too high. And the things that cause insulin levels to rise the most are refined carbohydrates. For some people, even some of the whole foods carbohydrates will be problematic, but for all of us, the refined carbohydrates will drive insulin levels too high, and that will naturally lead to insulin resistance.
Okay, and the problem, which we've all probably felt this, we've been hangry before, and you're just crashing, and you're so angry, and you're acting in ways that you would normally act. So I guess in that way, we've experienced that what we're eating to what our brain is doing connection. What are the solutions? What are the brain healthy foods that we should be eating that you're seeing make a marked difference for your patients?
Yeah, so if I had to recommend 3 changes for people, I would say if you're not already including some amount of meat, seafood, poultry, or eggs in your diet, that's important because there are nutrients in those foods that you really just can't get anywhere else, or supplement carefully. But the other 2 changes I would recommend are removing the refined carbohydrates and the vegetable oils as much as you can, because then you're nourishing the brain with some nutritious foods, but you're also, what I like to say is first do no harm. Take the foods out that we know are causing the problem in the first place. The inflammation, the oxidative stress, the insulin resistance is being driven by these ultra-processed foods that are loaded with refined carbohydrates and vegetable oils. And if you just eat whole foods cannot contain they don't contain any refined carbohydrates or vegetable oils. So it's a great way to start.
Okay, so let's even be basic about, people have maybe been familiar with the Whole30 or what is a whole food. A whole food is just something that we can eat without doing anything to it. Maybe you might have to cook it a little, but if it's chicken, but it doesn't have ingredients essentially.
A single ingredient food that you could find in nature, a peach, a fish, an egg.
So people are freaking out about carbs right now. I'm like, I'm never eating bananas, I'm not having grapes. What about, are we going too far with that? Is it okay to have most fruits?
Yeah, so it really depends on your metabolism. So if your metabolism is still healthy, you can still process healthy whole food sources of carbohydrates like fruits and starchy vegetables. But if you have a significant degree of metabolic damage already, which again more than 50% of us now do, you may need to cut back on even some whole food sources of carbohydrate. And really what you need to do is find your sweet spot because we're all different. Some people can still eat plenty of fruits and starchy vegetables. Others may need to cut their carbohydrates down all the way to even a ketogenic diet level. But some people may not need to go that far. And in the book, I show you how to test yourself for insulin resistance and how to find your personal sweet spot.
So let's talk about that. If you're hearing going, well, I don't know if I'm insulin resistant. I didn't know that I was till I took the test. And even though she wasn't overly concerned, she said we can move that number. It was clearly an explanation as she's like, you're not really processing carbs very well anymore. Yeah. So how do we know?
Yeah, so instead of the fasting, in addition to the fasting blood glucose and hemoglobin A1C that most of your viewers have probably already had tested,
that one.
Right?
Yeah.
Those are tests for type 2 diabetes. What you want is a fasting insulin level.
Yes.
To see how much insulin is your body needing to produce to keep your fasting blood sugar normal. So because that's rising and rising in the background over many years to keep your blood sugar under control until it can't do it anymore. And that's type 2 diabetes. So pre-diabetes or insulin resistance is rising insulin levels. Type 2 diabetes is the insulin levels are failing to keep you under control anymore, and now you've got a high blood sugar level too. So if you test your fasting insulin level, you want it to be in the single digits, below 10. Ideally even 6 is even better, but below 10. And I've seen people with insulin levels, in the 30s, 40s, 50s, 60s, 70s.
Okay.
Yeah.
Okay. So this is a test we can ask for, and that is readily available. It's not some fancy thing that doesn't exist.
It's not, and it's very inexpensive, usually $10 to $15, even if your insurance won't cover it, which it usually will. And if your doctor won't write the order for you, you can order the test yourself online through online laboratory through online laboratory services.
And often, I know sometimes I've asked and I love my primary care, but I certainly ask, like, what are you going to do with all that information? And that's maybe why it's not been tested so often, because people think, well, until we get to a certain level, I don't have a medication to offer you. But what you're saying is that you have seen making these dietary changes actually reverse mental illness, even severe mental illnesses in some of your patients.
In some of my patients and in our research as well. So we published a study in 2022. A colleague of mine in France placed 31 of his most treatment-resistant patients with severe schizophrenia, bipolar disorder, and major depression. These people were taking an average of 5 psychiatric medications each. They'd been ill for an average of 10 years, and nothing else had worked for them. He asked them to voluntarily come into the hospital, try a whole foods, very mildly ketogenic diet, really a low carbohydrate diet. And all 28 of the patients who stayed on that diet for 2 weeks or longer, every single one improved. 44% of them achieved clinical remission for the first time from their psychiatric diagnosis, and 64% of them left the hospital on less psychiatric medication. You do not see results like this in standard care.
So you mentioned 2 weeks. That doesn't sound very long. That's the other thing that I think when we do shows like this about changing your diet, people don't know A, exactly how to do it, and B, they want results to know that, is it worth it? Should I eliminate gluten? Should I eliminate this? You know, what's the protocol that you do with your patients that you're seeing is really working to, as you said, sometimes they're lowering their medications or coming off of them altogether?
Yes, that's correct. So I use a stepwise approach in the book so that people can gradually explore what level of dietary intervention they need that's going to work for them. So I have them start very simply with, it's basically a paleo-style diet, essentially, about 90 grams of carbohydrate a day. That's 2 to 3 times less than what most people are eating.
90 actually sounds generous compared to most weight loss plans, but yeah.
It is.
And 90 of the right kind, not 90 of cookies or ice cream or chips.
Exactly. So it's not just less carbohydrate, but it's better quality carbohydrate from whole foods, nutritious whole foods. And these digest more slowly, and they don't give you these steep, dramatic spikes and crashes in your glucose and insulin levels.
So there's so many kids right now struggling with ADHD, with autism. What is the dietary connection you're seeing as a Harvard-trained psychiatrist that you really need parents to understand?
Yeah, what I wish more parents understood, so I don't treat children. I'm an adult psychiatrist, but I read the literature and I know the studies on children, and I understand what children need to eat because the principles are all the same for all of us. We don't need a different diet for children versus adults, men versus women even. So we all need, the brain needs the same care throughout life. So for children, whole foods, meaning, you know, fruits, vegetables, meat, seafood, poultry, eggs, nuts, whole foods, and as little of the processed foods as you can possibly get away with, because those are what's damaging kids. It's really, literally damaging children's brains beginning at a very young age. So we've got wonderful research into autism, and now we're launching new studies in ADHD as well to try to see which dietary interventions are going to be most useful for those children, but really prevention is the best medicine. Feed your kids well from a young age, develop those good habits from a young age, protect their brains, because we now even see children with insulin resistance. And this is a very serious problem even among children.
So let's just say the average American family is also going to eat out a few times a week, running between sports. And you think, well, at least they're getting chicken. You know, there's some protein in that. But they're going to Chick-fil-A and they're getting a chicken sandwich and some fries. And you might be thinking, well, that's not that bad. Things could be worse. But what's your take on just how people are, you know, they're busy, they're trying to survive, and how that's really impacting them? Because if you look at your kid and they're doing all their sports and they look lean, you're like, all right, kids can eat anything. Why is that not true?
It's not true because you won't necessarily see the results on the outside the way they get experienced on the inside. So even very lean people and even athletes, even elite athletes, can have insulin resistance, and even very young children can. The only way to know if somebody has insulin resistance, which really what insulin resistance is doing to the brain, is it's gradually robbing the brain of the ability to produce energy. So and this can begin at a very young age. So the only way to know if a person has insulin, you can't look at them and tell. You have to test. You have to test a fasting insulin level, but another test that actually most people have probably already had is a fasting triglyceride level. That's part of your cholesterol panel. You want those triglycerides to be below 100. Below 100 milligrams per deciliter, that's a beautiful number. If it's higher than that, that usually means you're eating too much of the wrong carbohydrate too often.
Okay. So these are things that that test we would have anyway, your
Yes.
regular doc would do.
Yes.
So we need to look at, and I know you go in depth in here, this book is available anywhere, but the second half of it, here's a quiet paleo food list. Okay, meat, seafood, poultry, eggs. My co-host asked me, I think part of it is we're not educated. I asked my brother, do you know your blood pressure numbers? He's like, no. I mean, here's a man who works in finance. He could tell you, do complicated math in his head. Do you know your blood pressure number? No. Do you know your cholesterol number? No. Do you know your insulin numbers? No. What's a carbohydrate? I mean, we're not always. So let's do basics. Scott said, well, what do you mean? What do I eat for breakfast? And so let's start there. What do we eat for breakfast? What does it look like to have a brain healthy diet?
Yeah, so instead of having, say, cereal and fruit juice or bagels or muffins, that sort of thing, swap that out. Have some eggs, have some smoked salmon, have an omelet with vegetables in it, those sorts of things. Whole foods that include some animal protein and the fruits and vegetables that you enjoy.
What about, there's a big trend like avocado toast. People think that's super healthy because you got that healthy fat, but what about the toast?
The toast is refined carbohydrate. Unfortunately, there's no such thing as whole grain bread. You can't make bread without flour, and flour contains refined carbohydrate. So bread is a risk. And so, again, eat as little of that as you can get away with.
So you would rather people just have the eggs with fruit or just have the eggs with some avocado in it?
Exactly.
Okay, let's move on. What's a healthy snack? You're getting to morning and you're like, I'm really hungry. What am I gonna eat?
Yep. So again, you could have a hard-boiled egg. You could have a mozzarella stick. You could have some nuts.
Okay.
You could have some guacamole with celery or cucumbers. You could have a piece of salami. Anything that you enjoy that is low in carbohydrate and has some protein in it is going to be much more satisfying for you between meals.
Okay. So when we hear though, some people are like, oh no, dairy, and so you're okay with dairy unless you have an allergy, I guess. And what about salami? Doesn't come off as the healthiest food. Sometimes I give that to my son as a charcuterie or a beef jerky. I'm like, oh gosh, I don't know, is that so good?
Yeah, so I go into a lot of detail, but different questions like this are really important because for some of us, dairy is a real issue. So I encourage people, I actually encourage everyone to experiment with dairy because it is a major culprit, and I personally, it doesn't agree with me. So I encourage people to experiment with removing dairy to see how they do without it, how they feel. The processed meats also, these are not my ideal choices. My ideal choices are the fresh meats, but again, if you're having a snack and you're on the go and you're on the rush, a piece of salami is going to be so much healthier for you than if you grab a sweetened yogurt, or if you grab a granola bar, or if you grab a smoothie that's usually very high in fruit juice.
Yeah, unless you made it yourself. So you would immediately take out fruit juices, sodas, anything that really turns to sugar quickly in your body.
Exactly.
Okay, so we're trying to slow down the sugar spikes, essentially.
Yes.
So this gets a little interesting, but I would recommend, not only can you get this book, but there's people on Instagram, like the Glucose Goddess, who I follow, and she talks about, she does all the experiments with wearing a glucose monitor. And
Yes.
that's common now. If you want to spend the money, a couple $100 and wear it, you'll see it. I've done it, and it's pretty amazing to watch your own body react. But even food order matters, right? So you want to have your veggies, your protein, you want that first. If you are going to have a dessert, try not to have the sugars or the fruits or anything that spikes your blood sugar till after the protein.
That's exactly right. Lots of time of day matters, food order matters, quantity matters, timing of exercise matters, how much sleep you got the night before. Lots of things affect our metabolism. And the beautiful thing about a glucose monitor is it gives you a window into your metabolism that you otherwise wouldn't have. Most people find it really quite fascinating to see how their body reacts to different types of foods.
So I'm just gonna, in case people don't know what that is, I wore it for a story. People are like, oh, are you diabetic? And I guess maybe diabetics have to wear it sometimes. I don't know, but these are continuous glucose monitors, so CGMs, and anyone can get one. Could we ask our doctor to prescribe it, or do we just go order it and then watch it?
Well, unfortunately, in the United States, you still need a prescription to get a continuous glucose monitor, which I don't know why, but you do. So your doctor has to be willing to write you the prescription, or you can go online and sign up for a subscription service where the prescription is included in that service.
Yeah.
It's a lot more expensive if you do it that way. But if your doctor's willing to write you a prescription, usually, unless you have a serious metabolic issue such as insulin-dependent diabetes, you can't get the glucose monitor covered by your insurance plan. But if you just buy one patch, a patch gives you about 10 days worth of high quality data around the clock, what your glucose levels look like. It costs $75, $80 even out of pocket without insurance coverage. So even if you can just afford one, it gives you tremendous quality information about your metabolism.
Because what happens is, at least mine, it connected to my phone. It was an app.
Yes.
And so I could see, even I thought I was having something really healthy, like sweet potato nachos, okay? The base of them wasn't even chips. It was sweet potatoes with black beans. And I couldn't believe the spike. Now, I had that at like 7 o'clock at night, but it was all healthy whole foods. But I guess what I learned was, wow, I can't have a bunch of sweet potatoes and black beans at night when I'm tired, because I watched a spike go way up, and it took a while for it to come down.
That's the thing, is that, everyone's a little bit different, but a sweet potato and black beans they're just mostly starch. And so that starch, even though it's more slowly digested, it's still a lot of carbohydrate. So it's the quality of the carbohydrate, then also the quantity, and like you said, the time of day as well. So that's why I think it's so, and I explain in the book, there's a whole chapter about using glucose monitors and what you want your levels to be, so that you can use that to find your sweet spot. Some people can eat a sweet potato and they're fine, and others not.
Okay, so this is, one of the reviews says, mental health is undergoing a paradigm shift. Dr. Edith's leading the way. Do you believe that you're seeing that now, even in your practice? You're choosing to take clients only who are willing to subscribe to a food-first psychiatry model?
Yes, and really I've been practicing psychiatry for 25 years, and for the first 10 years, I practiced using traditional, medications and psychotherapy. And honestly, medications help some people, but they really don't help most people. And most of my patients were not getting that much better. And this is true for really all psychiatrists. And these are the most powerful interventions I've ever had access to in my professional career. I've seen not just tremendous improvement in long-standing mental health conditions of various kinds, but even sometimes complete recovery from even sometimes very serious mental health conditions. Decades of depression and anxiety, early onset dementia. It's really remarkable what you can see if you understand how to feed the brain properly.
Okay, so how long will it take for people to experience some healing and know that this is really working? Because I feel like success is what allows you to stay compliant.
It's exactly right. So I designed the food plans in the book for maximum efficiency, so that you will feel the benefits, if you're going to experience them, which most people will, in the shortest period of time. So what I like to say is you can see results in as early as 3 days, or in the middle, maybe about 3 weeks, and on the outside, about 3 months. So most people respond within about 3 weeks, but some really even in as few as 3 days. We're talking meaningful, noticeable improvement in mental health, mental clarity, stable mood, good focus, concentration, better sleep, mood stabilization. It's really noticeable changes that we're looking for.
So you really get into this, and I think that I'm reading it as a layperson. You can understand. You go in through exactly what are the whole foods, what are these problems, what is oxidative stress. So there's really some concrete changes. The problem is, I think, not everyone has, the book is a great place to start, but not everyone has guidance to someone like you. Perhaps their psychiatrist doesn't even buy into this and say, no, you need your SSRI or you need your ADHD medication. And you're not recommending that people just go off of it, but
Certainly not,
you've
no.
seen people be able to lower the dose or get off of it sometimes.
Thank you for asking about that, because there is a kind of a movement occurring in the field. So I actually train clinicians of all backgrounds around the world how to use these dietary principles in their practice, ketogenic diets and other nutrition principles, to help people with mental health conditions. And I have a free directory, a clinician directory on my website where you can search for a practitioner in your area to help you with these changes, because yes, you should not stop your medication without consulting with your practitioner. You should not attempt some of these dietary strategies that are very powerful, and you should not attempt some of these without medical supervision. So please work with somebody closely, and I've got a growing list of people who are ready, willing, and able to help you if you're interested.
So you're seeing people even with bipolar disorder, schizophrenia, autism have dramatic clinical results from just changing their diets.
Yes, and I share a number of stories in the book, different types of diagnoses, different ages, different types of people in the book, so people can see what's possible. And so it really doesn't matter what the diagnosis is, because if you're feeding the brain properly, if you're nourishing it, protecting it, and energizing it, then it stands to reason that just about any mental health condition could benefit. So it really doesn't matter what the diagnosis is.
So in our final 2 minutes, and I mean, we go on talking forever, but there's a lot of talk about supplementation too. There's a lot of nootropics on the market right now. People maybe who can't afford the medications or don't want to take them, so they're turning to saffron and GABA and omega-3s. Do you see in your practice clinical research behind supplementation to help?
Supplements can be helpful, they have their place, but again, if you're just kind of sprinkling supplements on top of a fundamentally unhealthy diet, you're not going to see the kind of results you really want. You really want to restructure your diet from the ground up in ways that will support every aspect of brain health. And often if you do that, you may require less supplementation because that diet will be more nutritious.
And that's where we've done many shows on this, but that's essentially what you're saying is gut health is brain health. And when we're eating bad food, our gut, where so many of our neurotransmitters are made, our brain signals, if our gut is not healthy, then it's very difficult for our brain to be healthy.
Yeah, that's your first line of defense. So when you eat food, your gut lining is really their standing guard, deciding what's going to be let in and what can't be let in, and needs to keep moving on towards the exit, if you know what I mean. And so if you've got gut damage, which again now many of us do, too many of the wrong things will be crossing into our bloodstream, and that can really cause a lot of damage as well. So healthy gut, healthy body, healthy mind.
Okay, and we're gonna have to leave it there for the time, but again, this is something that it is doable, it's practical. You're seeing people write you and even come out of your practice and say, oh my gosh, I'm so much better. So it's worth a try. So many of us are suffering with anxiety, depression, other things. Change Your Diet, Change Your Mind is the name of the book. Dr. Georgia Ede. You can get it anywhere, and just shout out your website real quick.
It's called diagnosisdiet.com.
Diagnosisdiet.com. Thanks for being here with us for this edition of Kara's Cures. Subscribe to the podcast. Have a great day, everyone, and be well.